born in Trinidad, so I'm Trinidadian, and I migrated to Canada when I was 10 years old in 1990. I had experienced at a very young age what living with a little sister who had a brain-based condition could do to a family. That was pivotal in me saying, I need to understand the brain more. I need to kind of understand how the brain affects behavior and what this means to families who speak different languages, who have different experiences in life. How can we support healthcare to be more diverse and inclusive? And that was really pivotal in me becoming a medical neuroscientist. I've been studying the brain for a very, very long time. Specifically, my research focuses on neurodevelopmental conditions, so autism, ADHD, even OCD. Now my research is looking a bit closer at mental health conditions and how they impact people of diverse communities. So right after my PhD, I did a postdoctoral fellow at the Autism Research Center at Holland Bloorview, the hospital. I was really involved in some excellent science that looked at the occurrence of these conditions across Ontario, across Canada to some extent. So that was a really great experience for me, kind of just understanding that a diagnostic is a label on paper, but we're talking about people and their lives and what's best for them in terms of treatment. I had a colleague of mine who completed her PhD at McMaster as well, and she was at Mohawk. And it was around the time that these two certificate programs were introduced as programs that needed to be developed for the college. And she said, you know what, Krissy, this looks like a great opportunity for you to help us to kind of design some of these courses. And that was my introduction. It was that the programs were approved and they were launched in 2017. It was the first of its kind, and there was an opportunity to come and join Mohawk to teach full time. And I said, why not? As a researcher, I love to collect the data, I love to process the data, I love to write the academic papers, but in my heart and given my life experiences, I want this information to get back to community practices that can really impact families and organizations who support families. So this was the perfect transition for me into a space that would support students who would then go out into the community and deliver evidence-based practices. What I enjoyed the most about our program is working with the students because they're so fantastic in terms of their diversity, how they add to the content and the learning environment. I would say I love that the most, as well as what they produce in that aha moment when they're in a discussion and they're realizing something for the first time, or it's adding to their knowledge, depth to their knowledge. And they start to reflect on their own experiences, which is a really powerful thing to bring about change in individuals and professionals. And they see how that might relate to the professional they want to be. That's a very special moment for me, and I really enjoy that. I am a reader. I'm also very much within the community. I love to support BIPOC community activities and initiatives. They tend to have a bit of stigma around mental health and mental illness. So as much as I can, when the opportunity arises, I would support those organizations in their education of their clients, and also supporting with tools and tricks to kind of support mental health. I'm also a boy mom. Both my sons are athletes at a very high level, so we do a lot of road trips, a lot of flights around North America so that they can, do what they do best and kind of prepare for university and those kinds of things.